Hello, and welcome to our Tuesday talk. And before you say, Paletta, it's not Tuesday, I know. We had a little technical difficulty, so we're going to redo the video, and I know it's Wednesday. So what are we going to talk about? Tummy tuck. Sounds pretty basic, but we're talking about something really exciting. What's exciting about tummy tuck? Specifically, the drainless tummy tuck. This has been revolutionary. I really, in my practice, have not used drains in a tummy tuck for 2 years, okay? Drainless tummy tuck is something that's not new. It's been described. There's a procedure called progressive tension sutures, and it was very tedious. It required a lot of individual stitches to be placed. Now, with the new suture technology that's available, it has decreased the amount of time, and now it's made this available really for all plastic surgeons to use. So what are the benefits of the procedure? And actually, let me take a step back before I talk about the benefits and the downsides. Why do I offer it? Well, I personally will not have a tummy tuck if I have to have drains. I feel that strongly about it. Okay, and that's something I'm thinking about doing, but not if I have to use drains. Okay, so what are the benefits? Well, we've hit on it. Number one, no drains. Okay, what does that mean? Well, the drains stay anywhere from a week and a half to maybe 3 weeks, and sometimes even longer. And you ask people about what their experience are with drains, they're going to tell you. You're going to get some very specific answers, and I'm going to go into that a little bit too. What's the other benefit of the drainless tummy tuck? Because you're taking off pressure from the incision as you move down the abdomen, you're going to get less tension at the suture line, and then in theory you're going to get better scarring from that. Okay. Now there are some drawbacks, and what are those? Well, number one is, we had mentioned, it takes a little more time to do the procedure. In my hands is about 30 minutes extra. Okay. 30 minutes extra is expense in the operating room. And the other thing is the expense of the suture themselves. The sutures are considerably more expensive than a regular suture, okay? Now, I already told you I felt strongly about this procedure. How strongly did I feel about it? I put my money where my mouth is. I do this procedure for patients the same cost as a tummy tuck with drains. Does it cost me more money because I'll spend more time in the operating room? Yes. Does it cost more money because I have to buy more expensive sutures? Yes. I save some money because I don't have to use drains, so there's, I guess, a little bit of a give and take, but I feel strongly enough that it's a superior procedure. I would want it for myself. I would want it for my patients, and I don't charge them any extra to do that. I think it's that important and that worthwhile, okay? Now, if this is something you think about, what should you do? Like any procedure, ask friends or colleagues that may have had the procedure. Ask them about them. Ask them about a tummy tuck if that's something you're thinking about, of course, but then ask them specifically, what were the drains like? They're going to tell you. Or maybe you've had friends who've had mastectomies. What were the drains like? You're going to get some answers like, oh gosh, I hated those things. I couldn't wait until they came out. They hurt. They burnt all the time. I couldn't move in certain positions or certain ways. I had to sleep a little bit different because of the drains, the way they pulled and they tugged, and just can't wait for them to get out. And that's the one thing they still remember about their surgery, even years later, okay? Ask nurses who take care of patients in the recovery room what the difference is, how they are more comfortable, easier to move around, easier to take care of their incisions and surgical site. Okay, so if you're interested in a drainless tummy tuck, my contact information is obviously available, or you can call the office, and I would be happy to meet with you and discuss what your specific goals are and come up with a plan just for you, because we have used this in all versions of tummy tuck. Standard anterior tummy tuck with liposuction, around the world tummy tuck, which is something that is a Savannah kind of term. Nationally, it's more known as a belt lipectomy or lower body lift. And that procedure, with and without liposuction, I've used drainless techniques in all those versions of tummy tuck, and I think it's a great option. Thank you.